We're in the boot heel of Missouri, or close to it. We're about 25 miles from Arkansas, in the foothills of the Ozarks. The community itself is about 17,000. The county population is about 45,000. It's primarily rural. We have a lot of Medicaid patients, a lot of Medicare patients, and about a third of our patients have commercial insurance of some variety. We were paying a lot of people to manage a lot of paper, and it wasn't being done very efficiently or effectively. It was difficult to find information in the chart. We had lab tests on all kinds of little strips of paper. We had sticky notes in there. So it really was not a very efficient system. In 2003, after we became a rural health clinic, we decided getting an electronic health record. First of all, we established a committee made up of doctors, nurses, IT staff, administration. We also had our lab radiology departments involved, because it involves a paradigm shift, really, in a major shift in the way we do business. There's a lot of technical jargon that you can get bogged down in. It's important for the doctor or the nurse, or both, to ask them specific questions. How do I do this? How do I document this? How do I find this? How do I refill a prescription? And make the vendor go through the various steps. Doing site visits was very, very important, especially to the physicians. A single physician, or even a 2-physician, 3-physician practice, you should certainly involve your office manager, your nurses, your receptionist, because they're the ones that use the chart just as much as you do. We're much more productive. We're much more efficient. It's probably one of the, I'm talking to our administrator who's been here for over 40 years, says it's probably the best thing we've ever done. Well, certainly the nurses would say that refilling prescriptions is the biggest benefit that they've seen, because they don't have to ask for the chart. It's already there. They can refill a prescription or get it authorized while the patient's still on the phone. One of the surprising things was that we had so many people in transcription and medical records, and we didn't have to terminate anybody. They either left through attrition or transitioned into another job. So it really didn't impact negatively on our workforce. And lots of times the doctors will show the patient on the computer their lab results or their x-ray. They can trend their lab results over time, so the patients can actually see improvement. I would tell any physician practice that if you want to compete in the 21st century, you have to do this. It's not a question of should you, do you have to. It's going to be a necessity.